Hello healers, my name is Ben, and this is the Moss Report, coming to you from the Hubert H. Humphrey Federal Building in Washington, D.C. We're about to get a presentation from Secretary Kennedy and Secretary McMahon, Department of Education, about a new curriculum that's being developed to include or expand on nutrition education at medical schools across the country. So there are a lot of people in the audience here who are representing different medical schools. So we'll see what the secretaries have to say. I'm looking forward to sharing that with you.
Ladies and gentlemen, we're about to get started soon. You can begin taking your seats. Thank you. Thank you.
Please welcome our Secretary of Health and Human Services, Robert F. Kennedy, Jr. Thank you.
Good morning, everybody. I can't tell you how excited I am to be here today, and thank you all for joining us. Today, we mark an historic announcement delivering the solution to a problem the American Medical Association first identified 60 years ago when my uncle was president. Together with the Department of Education Secretary Linda McMahon, I'm pleased to announce a transformative breakthrough in medical education that will reshape as the way that we train doctors in our country and deliver on President Trump's promise to end the chronic disease epidemic in America. 53 medical schools across 31 states are driving the national movement to champion nutrition education and reshape the future of medical training. Beginning this fall, these schools will require every medical student to complete 40 hours of comprehensive nutrition education or competency equivalent before graduating. More than 30,000 physicians each year will now graduate equipped with nutrition education to help prevent, treat, and reverse chronic disease. This is how we implement the MAHA agenda. This is how we make America healthy again. Thanks to the deans and senior officials representing 53 medical schools, as well as leaders in medical accreditation who have been working on this exciting announcement. We know why we are here. Chronic disease is overwhelming our country, and it is accelerating. When my uncle was president, we spent zero on chronic disease in this country. Today, we spend $4.5 trillion a year on healthcare, and 90% of it goes to managing chronic disease. Poor nutrition is often at its core. 6 in 10 American adults live with at least one chronic disease. 4 in 10 live with 2 or more. 38% of our teens are pre-diabetic or diabetic. Nearly 40% are overweight or obese. Almost 1 in 5 adults has non-alcoholic fatty liver cancer. When I was growing up, doctors rarely saw any of these conditions in children, and now they are commonplace. Medical education must teach the science of nutrition. Yet today, the average medical student report receiving less than 2 hours of nutrition education every year, and that ends now. In conversation after conversation with leading researchers and medical school deans, I heard the same message. America's academic institutions stand ready to lead. They want to bring the full weight of American science to this crisis, and they want to move faster than anyone thought was possible. Our doctors are among the most dedicated and professional in this country. They chose this calling to heal. The leaders in this room are not the obstacles to reversing chronic disease. They are the solution. Today's announcement strengthens the doctor-patient relationship. It equips physicians to work hand-in-hand with dietitians and other health professionals. And it shifts our system toward prevention instead of perpetual prescriptions, with the promise to lower healthcare costs in the process and to give us higher quality and better health. To accelerate this effort, HHS will invest $5 million through a multi-phase NIH Nutrition Education Challenge. We will support curriculum development and fund clinical training and gold standard science. We will extend this effort beyond medical schools to residency programs, nursing, dietitian, and nutrition science programs nationwide. To be clear, today's announcement is not the Trump administration dictating medical curricula. Today represents a mutual recognition that HHS and leaders in American medicine can come together to advance shared goals and interests. After months of seeking feedback, we landed on a clear standard: a minimum of 40 hours of nutrition education across all 4 years of undergraduate medical education. For schools that felt competency-based learning was a better benchmark for mastery, we partnered with national experts and those medical schools to build a framework grounded in gold standard science. 71 evidence-based competencies across 10 domains. These competencies are not a curriculum, and they are not a mandate. They are one resource among many and a non-exhaustive list. This morning, we unveiled a public website, hhs.gov/nutrition-education. That's hhs.gov/nutrition-education. If you visit this website, you can see whether your alma mater or the medical school you're considering is on the list. And you can click through to see medical school commitments and their plans for putting nutrition in the classroom. This website is not just about us championing their efforts. It's a public commitment from these institutions to hold themselves accountable, to be a public leader and a catalyst for change. Additionally, the HHS Office of the Assistant Secretary for Health, led by Admiral Brian Christine, will soon require the more than 5,000 officers in the Commission Corps of the U.S. Public Health Service to complete continuing nutrition education as part of their professional requirements. Admiral Christine and his team will convene national experts in the coming weeks to ensure that our Commission Corps is equipped with the leading science to best serve the country. At HHS, we are leading by example. This is how the movement starts. If your school is not on today's list, that does not mean the door is closed. We welcome you, we encourage you, we expect you to step forward. We thank you very much, and we want every medical school in America to participate. This is one of my proudest days at HHS. I now welcome my friend and my colleague, Linda McMahon.
Thank you so much, Bobby. It's a pleasure for me to be here this morning. We really do have to focus on our nutrition. It is so incredibly important. We know that there are certain foods that cause inflammation, and how much of the different diseases that we see today are just really inflammatory responses. Today's announcement puts nutrition and prevention front and center in how we train tomorrow's doctors and healthcare leaders. Diet-related chronic diseases contribute to roughly 1 million deaths each year and impose enormous economic and emotional costs on our population. And a staggering 14.7 million school-aged children today suffer from obesity. On average, medical schools have required only about 2 hours of nutrition education to earn a diploma. 2 hours. All despite strong evidence indicating that nutrition is a powerful tool for preventing disease. Even more striking, a recent study found that a staggering 75% of U.S. medical schools have no required clinical nutrition coursework. This isn't a minor training issue. It's an institutional barrier to better health outcomes, and we today have the power to fix that, and as Bobby said, today we are moving forward. Secretary Kennedy and I have jointly urged medical education associations to study the best ways to elevate nutrition in their programs. In Congress, members from both parties have called for stronger nutrition competencies in medical education. And today, dozens of institutions, many of whom are represented today, have pledged their commitment to make comprehensive nutrition education a graduation requirement. a full 40 hours, as Bobby mentioned earlier, or competency equivalent, starting this fall. So we're not wasting time, starting this fall. We respect the independence of medical schools and accrediting bodies, and the Department of Education will never mandate curriculum. That's not our job. But we can and will spotlight promising evidence-based models, convene leaders who are improving health outcomes, and celebrate institution-driven curricular reforms that are reforming medical education. These actions promise real progress toward our shared goal of a healthier America. Thank you very much. Thank you.
So we've just left the Hubert H. Humphrey Federal Building, the offices of the Department of Health and Human Services, where we were able to listen in on the press briefing from Secretary Linda McMahon and Secretary Robert Kennedy Jr. The upshot of it is that there's a partnership that they've developed to expand nutrition education within medical schools across the country. Part of the Make America Healthy Again project. I was thinking there would be more in the way of talking about the curriculum. So we don't really have much to go on at this point. I'm going to see if I can't get my hands on that curriculum and determine whether it has any actual sort of progressiveness to it. If you're not expanding also access to information about nutritional supplements and about other aspects of how food and food extracts can prevent and to fight disease, and you're focusing on, the sort of the low-hanging fruit, as it were, of the food pyramid and making sure people have enough to eat, then we're really not talking about any major advancements or developments in the crumbling of the wall between conventional Western medicine and natural medicine, which is something that, of course, we generally like to hope for. Of course, when the press had the opportunity to ask questions, I had my hand up the whole time. I had several very pointed questions that I wanted to ask about the curriculum and supplementation and this type of thing, but unfortunately they didn't call on me to ask my questions. So we will still have to just wait and see what they come up with, and for now we'll just speculate and see where it goes. Overall, though, I would say it's a good thing for any federal agency to be taking more of an interest in how food is medicine and how it intersects with the medical process. So that's my report from Washington, D.C. For the Moss Report and for Townsend Letter, I'm Ben Moss. How are you healing today?